But let me talk about the other issue that Ken mentioned. I am convinced that under Medicare, we can also do a better job by focusing more on what is done so well here. And I consider Menorah Park to be a pilot program for what we're trying to do at the national level. Senator Ron Wyden, some of you know from Oregon, and I have proposed this issue called Better Health Rewards. And what it is, quite simply, is that under Medicare, you have an annual visit, and during that annual visit, you would be, on a voluntary basis, able to participate in an incentive program to improve your wellness, preventative health, and it is, again, much like what's done here. This would provide, under our legislation, some financial reward for seniors. Here, it's more incentives. And as some of your physical therapists told me earlier, when they were talking about the program here, they said, "You wouldn't believe, Senator, how competitive our seniors are." And I love that. And it's true. Seniors are good shoppers, seniors are smart, seniors are competitive, and seniors are perfectly capable of taking care of themselves, particularly if given the right information and some incentives help. So that's what this program would do. So when you go in for your physical, if you want to participate in it in several areas, including BMI index, meaning weight loss, but also including smoking cessation, also including diabetes prevention, also including cholesterol, you agree to participate in this program. And then over the next couple of years, as you have your physicals, if you attain some progress in these areas, guess what? You get a reward, and it's a monetary reward. So people say, well, how can Medicare afford that? And my answer is very simple. This will be a very good deal for the taxpayer, because people will be living healthier lives and having fewer acute problems, fewer hospitalizations, fewer issues that, of course, are associated with things like diabetes, because they're taking some sensible steps, as we've seen here with your workout room and your physical therapy room and your pool, to take care of themselves with diet, exercise, and so on. We have an analysis that indicates this would save actually lots of money. We think billions of dollars. And also, again, voluntary. Seniors don't have to participate, but for those who do, the opportunity for them to live not just longer lives and healthier lives, but also happier lives. Because being able to take care of your health, as I've seen here today and talking to people, is not just about your physical health, it's also about your mental health. And so that's the program that I'm announcing today. We did introduce this legislation last Congress. We're introducing it again in this new Congress. We're working on the details of it because under the SGR legislation that just passed, things changed with regard to reimbursement, so we want to make sure that it's consistent with the new SGR. But it is something that I think is really exciting. Of course, there are a number of things that need to be done with regard to Medicare to be sure it's sustainable over time. I understand that. But this is one I think that, frankly, Congress has missed, and administrations through time have missed. But there's a great opportunity here to promote preventive health, to promote wellness, and through that, to help sustain Medicare, which is such a critically important program. So again, to the 1,000 compassionate and dedicated staff members who work here, congratulations. To the 1,000 people who live here, congratulations, because you're part of this organization. I loved in going around talking about how things get done here. I understand there are lots of committees that get formed, and that the residents have a lot to say about what happens. I saw a library, for instance, this morning that was entirely designed by residents here, and I'm sure that sometimes you all have comments on various things, including the food, but I understand the food is actually pretty darn good here, maybe thanks to some of your comments. So I hope this Better Health Rewards program can be a model for Medicare. I think what you're doing here, I consider a pilot program. By the way, the Cleveland Clinic also is very engaged in this. In fact, they brought this idea to me several years ago, which is why we're now where we are. They use this for their employees, and I know they're very involved here at Menorah Park as well. And I look forward to coming back to visit you again And in the meantime, I will just say two things. Go Cavs.
Thank you so very much, Senator Portman. And first of all, before I do my formal words, which are going to be very brief, I want to thank this great audience here who represent people from the community, from the outside community, from the Menorah Park campus community, our many partner agencies and community representatives with us today. Very much appreciate that. I usually don't single anybody out, but I'm going to right now because I have that prerogative. But the reason why is Esther Saginaw here in the front is 103 years old. 104, I'm sorry. 104, I'm sorry. Now, I got to tell you for a minute, Senator, and the audience about Esther. Esther was a volunteer nursing home ombudsman for the state of Ohio for, I believe, how many years, Esther? I think over 30 years, I believe, where she would come to facilities such as Menorah Park Nursing Home and be here with a notepad, interview residents, families, and advocate for them to be sure that they got the best care and services and their voices were heard. And so I want to really give a thank you for Esther to be here with us today and to honor it's a real honor for you to be with us, Esther. Congratulations. So back to Senator Portman for a moment. It's an honor to welcome you to the Menorah Park campus toward the services, meet our clients. We appreciate your caring and your support and leadership on behalf of the nation's elderly. On the Menorah Park campus and here at the Peter B. Lewis Aquatic and Therapy Center, our philosophy is one of health and wellness for seniors. This philosophy aligns perfectly with your Better Health Rewards program that you just announced today. For over 15 years, the Lewis Aquatic Center has served over 8,000 clients, keeping them healthy and living independently in the community. Today, we commit to you, Senator Portman, that we will be serving as a model site for the Better Health Rewards program locally and nationally by adopting the program focus areas in the legislation. Our staff at Lewis Aquatic will be working with clients selecting program goals, measuring those goals, setting up treatment plans to ensure success of those goals. And this will include educating clients on the program focus areas which really focus on health, prevention, and promotion. So in summary, we appreciate the wonderful partnership with you, and we thank you for developing such an innovative national model, and we look forward to serving as a model site. And thank you all for coming today. Thank you so much, Senator. We appreciate you.